Welcome to the PharmaSource podcast. All this week, we're releasing interviews conducted live at CPHI Milan. And this first episode is with Henny Zijlstra, Adragos Pharma's Chief Commercial Officer. As you'll hear, the interview was recorded live from the show floor, so there is a lot of background noise. So we also have a full written transcript on pharmasource.global. We're going live from CPHI Milan, and I'm here with the Adragos Pharma team. Henny, would you mind introducing yourself, please?
Sure. So, thank you very much. My name is Henny Zijlstra. I'm the CCO, Chief Commercial of Adragos Pharma. We are relatively new CDMO to market, 4 years old now. I've been with Adragos for a year.
Okay.
Drug products, small molecules, focus CDMO. Yep.
So only 4 years. So what was the story with how the company came about?
Yeah, that's a good question. So you should ask our CEO, but I will tell his story. So he worked at one of the larger competing CDMOs that are still existing in the market, and he really realized customer centricity is something that is lacking in our industry. And he said he knows that he can do it differently. So he partnered up with one of the investors, and he took the opportunity to acquire the first 2 sites in our network to really say this is how we are going to bring a fully customer-centric CDMO to the market. So excel there, and he started in the middle of the pandemic, so obviously very challenging. Found a private equity firm to partner with them. So we are private equity funded, and since then we've been rapidly expanding. So we're now with 5 sites in our network, and we're still growing. So yeah.
Where are those facilities?
Yeah, so it's we have a Western-focused network, Western quality, I would say. So we have sites we have a development site that is our pure development site in Athens. Okay. So all of the sites we acquire we call Adragos Athens. That is the development site. It's dedicated for development. 70 people, and they develop all dosage forms for small molecules. So we also offer standalone development services. Then in manufacturing we have the footprint in Livron, ampules and suppositories. Then we have Leipzig for semi-solids and liquids. So Adragos Leipzig and Adragos Livron. Then we have a large site in Halden Pharma, it's in Norway, which is recently acquired this year. Blow-fill seal and IV bags, also manufacturing focused. And then in the Japanese market we have a large site which is Sanofi site, where we focus on visual inspection and packaging, as well as oral solids manufacture for the local markets. Yeah.
Very, very well remembered.
Yes, it's almost a full globe, so we only missed the US, but we're looking at that as well.
Incredibly fast growth, and
yes.
I guess that's I suppose being private equity backed. I imagine you've got sort of quite ambitious growth targets going forwards as well.
Absolutely, yes. We are. I mean, if you want to define, and we had a question yesterday, how would you define us? And then we could say speed is how we excel. Also, that's why you can see that the sites that we've acquired, they're not easy to acquire sites. There are a lot of potential buyers, so we do excel in that case in speed. Ideally, we look at big pharma sites, ex-big pharma sites that are looking for divestment, but that is not my responsibility. There's a corporate development team for that. But speed is, so we have, we of course have a buy and build strategy. We invest in the sites, but we're rapidly expanding. So you have to keep an eye on us. Next year, when we speak again, then we will not be the same. I know for sure.
So that's incredibly rapid growth there of capacity, I suppose.
Yes.
How is that working in terms of filling that capacity, and are there particular modalities which you're interested in? How's that working?
Yeah, so we always say we're really drug product focused. So we are drug product small molecules. That is what we do. So the developments, I don't expect us to expand too much on developments, because the capabilities with hopefully an acquisition that is upcoming in the short term, we will be able to really support all dosage forms. In manufacturing, we miss at the moment a European or US site for oral solid dose, which we really want to complete a portfolio with. But yes, so we're looking at, let's say, filling it with, like I said before, it's a customer-centric approach.
Yeah.
It's the speed, it's the connecting and knowing really what is behind an RFQ. So when we order an RFP, when we receive a request, like what is it the customer really needs, and that we try to solve. So we, of course, everybody has to offer at a certain price, but we're looking at the service that the customer needs.
Yeah, that's really interesting. So I was having a conversation with someone yesterday who will remain nameless, but they were saying that in pharma, in pharma services space, customer service is so poor with their tech. If you compare that to this kind of platforms that everyone's used to, whether you're Airbnb or using Amazon or Netflix or these very customer service orientation platforms that people are used to. How are you thinking about that? How are you thinking about driving that change into what's quite a traditional industry?
I always say like we're 40 years behind, not even 20. I think this is what we are. But look, that was the whole reason why we started with our business. So we do see that we have a head of digital who's really into digitalization in AI. So we are embracing it. We are looking at like I said, getting closer to the customer, transparency. So we do have we are developing also our own softwares. Okay. For example, we have our own Adragos ChatGPT. So we have our own. But I do think so if you keep an eye on this, it is something that we have on the radar to launch customer portal where a customer could log in, have full transparency. What is the status of their orders? Even the CDA, and who knows exactly where their order is at what moment. It is on the radar. It's not ready yet, but we have it in the short term, and that's how we think. We will never be Amazon, but yes, we have to learn from these kind of examples.
Absolutely, it is that digital layer, which is transformation.
Yes.
One final question then, Henny. If you were to sort of look at the trends which are shaping this industry at the moment and thinking about 2025 and beyond, is there one thing that you would call out as being particularly important for you and the business?
For me, there's a lot of important things in my life, but for the business in general, like we said, we are focusing on onshoring. So we know that we cannot compete to Asia or to India. That's not who we are. So we are focusing on having a reliable, sustainable supply. We see customers as our partners. So we are also not. We do have single products, but we usually look at how can we support the customer from multiple sides and look at it from that angle. So we're not looking for 700 customers. We want to partner. I think the customers that fit are the best are the regional players who have the regional footprint in Europe. In the Japanese market, it's for the Japanese market, it's a different story. But I would say when we're talking about our development and our manufacturing capabilities, I think we are the ones that can support the mid-size, the regional players, the ones because they also appreciate service levels more. So I see that as for our future as Adragos, this is where we will grow to excel even more.
Henny, thank you so much for your time today.
You're very welcome. Nice to meet you.
To keep up to date with the latest in biopharma outsourcing, sign up to pharmasource.global. Thank you for listening.